So the title of the webinar, Legal Considerations Concerning Digitizing the Surgical Pathway. I'm your host today. My name is Mazin Gadir. I have also the plan of the series in front of you. We will have another series, another webinar on the 29th of June, where we look at the importance of informed consent with IDO Healthcare, and then the benefits of a digital preoperative assessment pathway with synopsis, and finally concluding our series at the end of July and digital anesthetic data capture during surgery. Again, it's going to be a very busy couple of or a few webinars that we will take in a series of couple of weeks. We will also entertain you or ensure that we remind you of these as we go through. Please follow us on LinkedIn continuously and ensure that you are able to join us in the coming series. Tell your friends about us and follow and link up with our speakers and guests in this webinar. So my name is Mazin. I've been in this region for almost 42 years, practiced digital health for almost 21 years. And currently I work as the Director of Partnerships and Strategic Alliances in IQVIA. I had the pleasure of working with our guests in multiple areas, specifically when I was at Dubai Health Authority, managing the digital health strategy, and also working closely with our leadership team at Dubai Health Authority in my previous role in the Organizational Transformation Executive Office. Our guest speaker or our guest panelist today, interviewee, Christina Sochacki. Christina is a senior associate in the corporate commercial practice in Tamimi Co. She is a former intensive care unit clinician. Since 2014, Christina has been a Dubai-based senior associate in the corporate commercial practice of Tamimi and Company, and a member of the Healthcare and Life Sciences Practice Group. She has been instrumental in advising actually Dubai Health Authority in many major projects like the telehealth regulation, and we've conducted multiple series educational on the recent groundbreaking healthcare data laws and different health information exchange programs in the digital health space in the UAE and the Middle East. In 2017, Christina was named the Middle East Legal Awards Associate Solicitor of the Year. Before COVID-19 pandemic, almost 30% of the patients waiting for operations were having their scheduled surgery canceled for non-clinical reasons. Again, this is very impactful in the healthcare ecosystem. It is estimated that 28 million scheduled operations across the globe were canceled during just 12 weeks in the pandemic or during the pandemic at its peak. And a very interesting reference report that I'd love the audience to have access to, Kpmg UAE Healthcare Perspective 2020. According to Dubai Health Authority, vacant nurse positions will increase by 460%, with vacant anesthetist positions growing by 190%. With countries now not allowing any travel, this is disrupting the medical and the healthcare workforce needs and supply chain of workforce talent into UAE and similar GCC countries. So this will definitely call for an important disruption, and also a lot of thought leaderships are coming here to enhance the sustainability and resilience of our healthcare systems in the region. So with our speaker, Christina, I'd love to see if we are able to also discuss some of those groundbreaking updates as we go through it. We will start with obviously looking at the surgery anesthesia pathway. Again, the engine room for hospitals starts with obviously a lot of requirements in the pre-op stage, as well as the intra-op and post-op. One of the most important and critical workflow processes within a healthcare environment. And this requires a lot of preparation before the surgery, record keeping, and meticulous tracking of what happens during the surgery, as well as important documentation and follow-up after surgery. In today's discussion, we'll definitely look at how the ecosystem is responding to these huge, impactful updates like cancellations of day surgery, the need for workforce and talent, specifically in the healthcare arena. So I think the key points or the talking points for today, we will look at the actual disruption in the legislative framework in the healthcare environment or ecosystem. Disrupting the health economy has become the name of the game since the beginning of COVID. And one of the key words and key trends that you're seeing as people speed up and run after hyper automation is what we call the hyper legislation mode, where compliance and I guess an obligation become compliance obligations becomes a necessity. Obviously the acceleration and digital adoption from health information exchange, electronic medical records, data transfer, and whatnot. And as the speed and the race to digitize becomes a fact of life, there is always the concern about preserving quality in the era of looking at building resilience and sustainability in the health finance and the reimbursement models that has become also another disruptor to the healthcare economy in the region. So with this, I think I would love to remind the audience, if you are able to share your questions in the chat or in the Q&A, that would be fantastic. I also want to bring to the forefront our guest speaker and interviewee, who will be an amazing subject matter expert that I'd like the audience to get in touch with, get LinkedIn, get also connected with her in LinkedIn. Christina, I would like to call upon you. I don't know if you'd like just to quickly unmute. I'm already seeing some people in the chat. Some important points. Please follow the chat. Please put your questions. And we are very delighted to have you with us and to start this wonderful conversation. So I think what I would love to start with, Christina, is first perhaps give us a bit of a something that I haven't yet put in your introduction about how you are viewing this era, this digital health era.
Well, as you mentioned, well, first of all, thank you for that very kind introduction and to Synopsis for having me here. Your intro was quite thorough, so I'm not sure what else I'm going to add. But I think in this current time, it's busy, and it's busy for everybody involved in the healthcare industry. As you mentioned, with kind of this hyper legislation as a response to COVID, but then what I've seen too in the UAE and across the region is it's also a response to a bit of a lacking in an upgrade to the healthcare legislative system. And so a lot of regulators took the opportunity to not only respond to COVID and of course put in all the COVID specific responses, but then look at how this new way of servicing patients will be impacted by the current legislation, making amendments, and during those amendments also making updates that maybe had been planned, but we're going to sit on the legislative docket for quite some time. until regulators got around to actually publishing the new requirements. So on that front, not only I know is it quite challenging times for the healthcare providers themselves and those running the hospitals and clinics, but throw on top of that your friendly legal folks and regulators who are adding a new wave of often very positive developments, but sometimes burdensome. Any change will take change management, which is often quite involved and will have pain points. But when we look at it across industries and sectors, digitization is just fundamental. It's a change that is occurring everywhere. And often we ask, well, why isn't the healthcare system keeping up to speed with that? And so perhaps the COVID pandemic helped us to get there. And so during this time, probably the amount of legislation that we've seen come out of the UAE in 1 year has been more sometimes than, you know, a couple of years combined previously. And it's fundamentally impacting the way that healthcare facilities deliver care. And so if we're going to look at the topic of our conversation, I said the perioperative process, it's just key to the effective operation of a hospital. And you know, in the flow of patients through that, from ensuring that not only is the flow proper, but the clinical pathway is also appropriately in place. And digitization, of course, it will allow for more standardization across the different providers and how they are conducting the processes. Hopefully the hospital is implementing a digitization process that is quite efficient and quite compliant with the legal and regulatory requirements. So when we standardize that, we should have a greater adherence to documentation requirements and a more efficient and dynamic surgical care pathway. And that's just quite key to compliance with the current regulatory environment. I understand that in many places, the clinical pathways are still quite paper-based, and they're not fully integrated into the healthcare information systems, and that's just not going to be sustainable anymore. I'll talk a little bit later on, I think, in what I anticipate you'll ask me about the health information exchanges and all the developments in that regard that have been happening in the UAE. Paper just doesn't cut it anymore. And so I'd say that when we're looking at specifically any sort of digitization, but if we're drilling down into the surgical clinical pathway, you're looking for technology that's iterative, can be agile enough to quickly adapt to the new best practices, identify deficiencies in care, providing a very dynamic response in terms of insights into performance, quality metrics, targets, and also then, as mentioned, integrating the new legal and regulatory and compliance requirements. And that's one of the things, again, we'll talk about a little bit more in detail, is that the regulators, and particularly those when you come to reimbursement, are more acutely looking at, it's not enough just to do, document what you've done and do a bunch of tests and, kind of roll the patient out. They want to make sure that each stage of your process is optimized, from documenting and conveying to the patient what they need to do to prepare for their surgery, through to what's happening in the surgical suite, and then through to discharge and follow-up. So, for example, in the UAE, it's now mandatory for all hospitals to obtain international accreditation, and they have to do it before October 14th of this year. So what does that mean? There's a unified hospital standard across the UAE, and that addresses not only quality of care and services, it addresses patient safety, talks about requirements for healthcare professionals, hospital design requirements, and that's not only meeting the federal laws of the UAE and international standards also for hospital accreditation. So how do you do all that if you're dealing with policies made, papers distributed, clinicians trying to remember what they're supposed to do, how they're supposed to do it? For example, I remember when I practiced in the intensive care unit, we would have policies that would come out, we'd read the policy, it'd probably be posted on a board, and then we'd hopefully remember it. But then to update it or change it, there'd be a new policy committee meeting, they'd redistribute a new paper, we'd read it, we'd try to implement it and figure it out. It's just not sustainable, and it's just not going to be enough to meet the current legal and regulatory environment and the way things are going.
Sure.
So, sorry, Mazin, did you have something you
No, absolutely. And I think that's one great angle that you brought in from regulatory compliance and legal requirements. What I wanted to add is maybe spice up that question a little bit with the fact that we also have had a recent amendment to the healthcare ICD data law. How do you think the surgical pathway digitization drive would respond, or how could it be, or how did it respond, or how could it respond to such amendment when it comes to the flow of data, and how can this enhance the drive to digitize surgical pathway and related encounters? What are your thoughts on that?
Yeah, so I mean, this kind of loops into a few different things. So we have NABID in Dubai, we have Malafi in Abu Dhabi, and for those not familiar, this is the individual Emirates health authorities centralization of a health information exchange. There's also going to be one at the Federal Ministry of Health level, but that is not as developed as the NABID and Malafi health information exchanges. So more and more, the regulators are looking at the exchange of patient information, making sure that it's well documented, that there's a common data set across all the facilities in the UAE. So everybody has a minimum amount of necessary information on their patients when they walk in the door. They're also looking at then being able to extract from that data population health management information, quality metrics, things like that, which will then be used to evaluate hospitals. I know there's talk at one point about creating a grading system in the UAE for hospitals based on analyzation of this data. And so it's not just simply looking at data transfers in terms of you know, I am going to use an analytics company based in the UK, for example, or something like that to help with some of my processes. But it's becoming more complex and more complex. But for the most part, the questions we get about the ICT, which is the Information and Communication Technology in Health law, which is a federal law, is, well, I want to take advantage of a company that is based overseas that has some great tools to enhance the services I can provide at my hospital, but all their systems, their cloud, or their data centers reside overseas. And unfortunately, it's quite often that the amount of business or the size of the UAE, it's just not, it does not make financial sense to use a local data center in the UAE. So can they take patient health information and transfer it overseas to perform analyses, or whether that's sending labs overseas, whatever it may be, how does that work? And so on the initial phase of it, the ICT health law was aimed at creating data localization, which is a bit of a theme in the region. But very much to the regulators' credit, they realized that exceptions were required. And so the law does carve out exceptions for the transfer of data overseas, but it leaves it to the individual health authorities to detail that process, which has not yet been done. And they are actually, in turn, looking to the federal government to say, actually, you need to give me a little bit more parameters. This is a little bit more of a complex case. We don't want to put our stamp that, yes, it can go, but then there's a bunch of other laws that impact it that might be violated. And so, as I understand, at the federal level, we are expecting another amendment to come out, which will describe a clear pathway to be able to transfer that data overseas. So you might say, okay, what does this matter? Why do we care about that on this particular topic? And I think that's quite important when you're looking at your vendor. When a hospital is evaluating a vendor, while you might say the compliance obligation is on them, they're the ones processing the data, but you may be allowing them to tap in or sending data to them in terms of when you're asking them to evaluate your quality metrics or do some analyses to find gaps in your care, your outcomes. And so you could be a bit on the hook too for violation of these local data laws. And so that's why it's even not only from a provider professional standpoint to understand the laws that surround not only the provision of care, but the technology space, as it were, in the delivery of care. It's important that you recognize that what's required of your vendor in this regard as well, to make sure that you have a vendor who's completely compliant with that and will be able to quickly adapt to the new changing regulations, whether that be from a data processing standpoint or from reporting of quality metrics or integration to the health information exchange, because these are dynamic pieces of legislation that we're closely watching because we expect changes to be coming out over the next year or two in many different avenues quite quickly. So I think hyper legislation is not over, even as the pandemic seems to be, there seems to be a light at the end of the tunnel.
So that's a fantastic answer, and thank you for the elaboration. So maybe going back to the HIE programs that are happening across the whole UAE, you know, from Malafi on a Abu Dhabi level to Nabir on a Dubai level, and then the federal level, Riayati now. How do you see, I mean, already there is a drive to start registering EMR and HIS solutions that should be, you know, should be working in the, or should be offered in the ecosystem. What are your thoughts from your side? Because you've worked on the telehealth regulation previously, you've been exposed to the health data law on amendments, and prior to that, you've been exposed to the drive for digital acceleration in the UAE extensively across the three or four different regulator ecosystems, right? Regulatory ecosystems. What are your thoughts on specifically the surgical pathway and the digitization to try and fill in gaps that big EMR companies might not have that specific niche area? And where would you see the legislation framework driving the need for digitization and documentation, as you said? I don't know if you're okay with that question. You are on mute. If you like to unmute.
That's always helpful if you can hear my answer. So a bit of a tricky, I think, answer, because on one hand, the legislation does require that health facilities that do not have EMRs, they're mandated to acquire one, but that EMR must be able to integrate with the NABID and the Malafi respective platforms. And so on both of their websites, they tell you which ones, and of course, it will be your big ones, Cerner, Epic, and they'll identify a whole bunch of other ones. Of course, you can use any one as long as it can be integrated into the respective platforms. And that's required by no later than December 31st of this year. So quite quickly coming up to a deadline, and we have no indication yet whether that would be extended. So, and on top of that, the EMR implementation must achieve at least a minimum of a stage 2 in the HIMSS EMR maturity model survey. Of course, stage 4 is preferred. But so in that regard, the issue then becomes where you're saying that there are gaps in the EMR. Of course, the EMR will have to meet the minimum data sets required for integration into the platform. But does that address all the things that you may need, especially when you look at compliance with your quality metrics? You want to improve hospital efficiency, revenue, et cetera. You might need a little bit more than your EMR is providing. So, but the end point is that your digital surgical pathway must, in my opinion, integrate into your EMR. There's just, I don't think, any way around it in this current environment. And so I suppose there could be, I mean, there is quite a lot of legislation in terms of healthcare data, healthcare information and cybersecurity standards, all these things that surround this health information exchange, and then also really on a larger scale to the data involved or the patient health information ecosystem. And so we're then drilling down into the surgical pathway. I think there could be more legislation in that regard. Nobody shoots the messenger here. Of course, nobody likes increased legislation, but more from the perspective to ensure interoperability and to ensure that these EMRs, which have historically been known to be a little bit closed and not wanting to play well with others, that they do ensure integration with other services that might be more specialized like this, so that the hospital, the regulators, et cetera, can get a better picture of what is happening and clear information.
Absolutely, absolutely. And I think as an expert in the medical legal process, in terms of some of the pressing needs to drive the healthcare quality to a better place, let's say, by improving patient safety and whatnot. So I think one of the areas that probably would require more strategic move towards specific digitization and specific customizable digital solutions in the surgical pathway specifically is basically brings me to the third question. So from your legal perspective, what are the gaps in the quality of healthcare that could be addressed by automating surgical workflows? Because again, this is a huge driver, the fact that you wanna drive more patient safety, secure medical practice, and preserve patient experience. What are your thoughts on that? You're on mute again. Sorry, no problem. There you go.
You got it. Thank you. So taking it back to kind of the regulatory environment in place. So in Abu Dhabi, you have the Jauda quality metrics, and it requires the hospital to provide records to the Department of Health in Abu Dhabi in relation to certain performance indicators and quality care measures. And so it's important to have this data available. And of course, you want to not necessarily limit it to only what Jauda requires you to report on, but when you look at in terms of medical malpractice, DRGs, reimbursements, it's important to be able to drive quality improvement. And so I see that the digitization of the pathway really can help. It's a tool to drive adherence and also capturing complete information regarding the quality of care. And so the hospital then can set certain quality measures, evaluate against them, implement process improvement plans. And this is important also, as mentioned, I think in 2011, Abu Dhabi had implemented DRGs, but then just last year, Dubai implemented DRGs. And so the tighter you can be about the way you deliver care efficiently and effectively, in the end, the bottom line is better. So what did I want to say about that? Remind me, what was the second part of your question, Dr. Mazin?
Oh, yes, absolutely. So again, the fact that medical legal might also be linked up to the automation of the surgical pathway. What are the impacts of driving to close the loop? That's an area that I wanted always to inquire about. What are your thoughts on that?
So actually, that's right. I had a bit of an example. So in terms of medical malpractice, of course, this is on. I think we have a few clinicians on the line. This is on the forefront of any clinician's mind as they undertake the delivery of care. And of course, we think of big things: surgeries going wrong, adverse outcomes not intended occurring, things like this. But Medical malpractice cases can also arise of just a failure to properly document. And I have seen some of those cases where a claim will arise a few years down the road. We speak to the doctor and they said, yeah, I definitely did that evaluation, or I definitely informed the patient of that risk. And we say, great, show me where you charted that. Oh, I was so busy. It was just one line. It's simple. I didn't, of course I said that. I didn't document it though. Well, you have no evidence then. Unfortunately, how is the court to then, agree with you if you have no evidence that you did do it? And so simple things, which seem simple, but as just mentioned, are more potentially impactful in terms of just making sure everything is documented, and even from informed consent. Each of the health authorities have policies on what is required to be inserted into an informed consent form. What are the standards for what constitutes informed consent, how it's to be documented. And that's quite a bit for a healthcare professional to remember, or to even have studied in such excruciating detail as the regulatory team of the hospital will have studied. And so a clear form that can be updated to conform to the latest trends, perhaps in medical malpractice cases, the latest guidance from the healthcare facilities, and then also making sure that this is a time where, when it's digitized, you can require certain fields to be filled out before moving on. And so then that avoids some of these gaps or these things that typically get missed from being missed, because it will be a prompt in there to ensure that the clinician does this, that the clinician has documented that they provided this information to the patient. I understand too that some of these systems can actually just go ahead and send the information to the patient, and you have a document trail there of exactly what instructions were given to them. They, that the patient was informed not to eat past midnight or drink, the patient was informed to take this medication. These sort of things, creating a little bit of automation, then ensures that everything was done to the best practices that it should have been, and it was documented and is recoverable, is not buried in some paper charts that potentially also gets lost, but is documented there then, as we were discussing earlier, perhaps in an EMR, where then that can be retrieved and detailed that these procedures were in fact followed. And that sort of documentation, of course, continues through during surgery and then the post-op recovery period as well.
Absolutely. Absolutely. And I love the way you keep mentioning documentation. I know there is always a fear of burnout, because documentation is the skeleton of driving quality for a solid and robust medical legal process, for a proper automation adoption process. But let me come to a great couple of questions from the audience. And I want to thank Dale and encourage our audience to actually jump on the chat and put your questions up. Dale asks, first, do you see providers of healthcare services embracing new ways to deliver care using technology? That's a great question. What are your thoughts on this question first?
Thanks, Dale. I'll call you later about this question and for throwing it at me. I'm just teasing. This is a problem. We can't just blame healthcare practitioners. This is an issue in any sort of change management environment. It's an issue with our law firm, right? Anytime you take an organization who's used to doing things a certain way, and you tell them they have to relearn the way they're doing things, change the way that they have become accustomed to doing things, there is some pushback. There is some perhaps difficulty in implementing some of the systems. But that's where I do see that a properly implemented digitization can be quite helpful. Of course, strongly advised. I think it's silly to not do it without the involvement of the healthcare practitioners themselves. I mean, a great example is when I worked in the intensive care unit. I started in a brand new hospital. It was wonderful, and I walked in and realized there were holes in all the walls of this brand new hospital. Why? Because when they designed the hospital, the engineering said it would be wonderful if these plugs were here. Just looks great. Practically speaking, did not work. We could not plug in any of the intensive care unit beds into the wall based on where the plugs were placed, because there was no healthcare practitioner on the panel, on the discussion during the implementation of those designs. And so any vendor that you're talking with really does need to integrate the healthcare practitioner into the development of the clinical pathway. And I think from that point, you should then get better buy-in from the healthcare practitioners, because you're implementing a system that hopefully already addresses their concerns, demonstrates that it actually produces efficiency, it helps them do their job. Yes, there will be a little toing and froing as you figure out where to click or how to find the documents and information you need and how to record in the new system. But the end goal, of course, of all of this is to not create a burden, but to rather create increased output and easier performance of the work.
Absolutely, and you are hitting a very important point here, because again, reliance on workforce, and you can see workforce is disrupted now with the COVID-19 and the need for nurses and anesthetists and whatnot. The second question that Dale has is, are regulators creating an environment in UAE where new technology-driven care delivery models can be adopted? What are your thoughts on that?
Yes, but probably not on the same quite yet to the scale that those, for example, in the US, where Dale's from, or in the UAE might be accustomed to. I mean, just the country and the healthcare system is quite young as compared to these countries. But I will say in my 7 years now, 6 years, is the pace at which that change is occurring is more and more. Of course, with any regulator, you'll find where areas in which it is lacking, and there is still pain points for certain technologies. But even if you look at, for example, the telehealth regulation from the Dubai Health Authority, its first iteration in 2017, and then the most recent iteration in 2019. I mean, just leaps and bounds of how they took the first one, realized it wasn't quite exactly right, but it was a good start. And then they created a new one a few years ago, which then just was much more expansive in the type of telehealth platform, the telehealth, what is the definition of telehealth really quite expanded under the new regulation. So I do see there. I guess the no matter where you are, the issue is keeping pace with the changes in technology. I guess that's a good thing, though. You always want technology to outpace regulations. If regulations outpace technology, that means we've kind of stalled in our innovation process. But I do see that more and more so the regulators are looking at ways to adopt the new technology. Yet I won't guarantee that there's not some pain points as the new systems and processes are being put into place. Just by way of example, you can have the regulation come out, but then the health authority has to put together the licensing process, which could still take a year or so in some cases. So I think we're getting there, but I see that the regulators will welcome these discussions with new technologies and innovative processes much more widely than they were even a few years ago.
Excellent. And maybe, Christina, based on the great questions that Dale has put forward, because this highlights the workforce gaps that will become a more and more a pain point to the providers in this region and this specific geography. Maybe how would how would the kind of, what would be the downfall? Let's say, what would be the challenges in the sense that driving more automation in the surgical pathways could come could bring in? Does it does it does it require competency development for existing staff? Does it what sort of skill set that we need to focus on, and how would the regulators solve this challenge, perhaps when there is hyper automation in the surgical pathway? What are your thoughts?
So quite a complex question, because on one hand we have just a global workforce shortage of healthcare professionals, but yet an increased demand for healthcare services, and so those practitioners, you kind of need more for less, right? You need more output and less time, because you can't just easily hire a few more folks. It just, as I mentioned, globally, we're just at a shortage in terms of the healthcare workforce. And so, but on the other hand, as with change in any organization, there's a need to learn new skills, understand the technology, adapt to that. Particularly for, now I don't mean to be generalized against any sort of age group, but there is just, those who have been practicing healthcare for quite a long time and grew up in a paper-based system might just find it a bit more difficult to adapt to a computer system where it's not intuitive to them as it would be to someone who's just graduated from medical school. They might not understand a paper-based chart. All they understand is the intuitiveness of a digital process. And so the thing is, in all the regulations that I've seen with regards to use of health information exchange platforms, things like that, there are a lot of obligations placed on the users, and often those users are practitioners. And so it is a whole new skill set in a way. You go to medical school to learn how to be a doctor, but then you also needed to know how to understand and read laws and regulations. You also had to understand data privacy and data laws. You also had to understand how these technology systems work. And so what's the solution? I don't know. From a regulatory standpoint, certainly, now we don't want to ease the licensing process in a way as to reduce quality, but certainly looking at streamlining the licensing and maintenance of your credentials process can be done. I know often the healthcare professionals find a bit of a cost and time and effort burden with the regulatory environment and coming to the UAE. So I do see an opportunity there to just better support quality healthcare providers coming in and make sure that they don't face unnecessary burdens or hurdles. I know it has improved in the last few years. So this is just an old example, which I suspect is not still a problem, but just when the new PQR, the professional qualification requirements, these are the standards for all healthcare professionals in the UAE, when they came out, it was implemented at a federal level with the Abu Dhabi Department of Health and the Dubai Health Authority signing up to it, but then each implemented it separately. And so while the practitioner was fully licensed in Dubai, I've been practicing there for years, highly specialized, just someone that we really want to keep here in the UAE because just his services weren't matched, couldn't open up a similar clinic and get licensed in Abu Dhabi because the way they interpreted the requirements was completely different, and to be honest, didn't really make sense, but they only saw one side of it. And so that created an unnecessary burden, and also means that he ended up leaving. And the UAE lost out on a great specialized provider because his idea was he wanted to expand and serve more patients, and the UAE wasn't letting him do that. Now, again, this was a few years ago. I know the processes and things have improved. So I think that's one area that the regulatory environment can better support when it comes to the healthcare professionals and looking at how to, if you will, upskill and just ensure that they're supported in the best way possible.
There is a fantastic question that came out also from Dale, because you are alluding to revamping and disrupting the medical training and education institutions. So using such technologies and digitization solutions. So the question says, are medical training and education institutions embracing new delivery models in their curricula? In other words, is medical education keeping up with the technology changes? So for example, when you graduate, and again, if surgeons are graduating out of the medical schools in the UAE, do they actually get acquainted and maybe get exposed to such digital innovation? That's a very good question, Dale. Well done.
I think it depends. I think it depends where you go to school. Now, as we were talking earlier, to one of Dale's other questions, the UAE is putting more and more in focus because they want to be able to embrace and they want to be a destination for healthcare services, want to be able to embrace their technologies and just provide top-level care centers of excellence in the UAE. And so I have seen quite interesting programs coming out of the medical institutions in the UAE, but I think it depends on what institution you're going to, and whether that institution has the funding to revamp curricula, has the expertise of people to bring in to do these sort of trainings. I think the UAE is nicely positioned in that. They can get quite a large, diverse group of folks to come in and talk about technology. I mean, just look at the diversity of healthcare entities here, from medical devices to pharmaceuticals to telehealth providers to those coming in and implementing quite innovative solutions across the region. And so when your students can access those people, have workshops, have seminars by them, I think you can open that door. But that might be a bit more of a deeper discussion about inequality in education for a completely different seminar. But it's exactly the type of questions we should be asking when we look at those who are accrediting healthcare education systems, or I'm sorry, medical schools, that they should be requiring these sort of things to be integrated, because it's not enough to know the science anymore. It's absolutely not. I think doctors need business courses, they need accounting courses, they need quite a bit more to really effectively do their job. Unfortunately, the days of just doing your medical care and that are not there anymore. There's many more obligations on healthcare professionals these days.
Absolutely, absolutely. And I think the focus of today's webinar on the surgical pathway, one of the most lucrative and revenue generating means for every hospital, and by being disrupted during COVID-19, knowing that day surgeries can be canceled and your revenue generating pipeline is going to be impacted. This is why I think the need for certain digitization and specific high risk and critical pathways in a patient journey, specifically from the sustainability of hospitals and secondary, tertiary care facilities. But coming back to one maybe last question by Khalid from Itisalat, where he says, I mean, the impact of digitization of health services has been profound, and definitely new entrants and big players like telco has been also driving some of the success of the digital transformation in this region, in this country as well. And he goes on to say, is expected to be even more profound in the near future. You know, COVID-19 is now revamping digital transformation strategies, cutting the life cycle of strategies to 1 year or 2 years, and people actually challenge this to quarterly strategies now. So important frameworks and practical guides for the evolution of digital health services is or have been proposed. Do you believe, from your expertise, Christina, and your legal, I guess, legal experience, do you believe that WHO frameworks can serve as a starting point, international approved methodologies could actually help in shaping more digitization methodologies in the UAE? Would that be a quick win? What are your thoughts?
So I have not dove deep into the referenced framework, but in general, obviously something coming out of that organization is going to be quite well researched and elaborately put together. And I do see that the UAE is not shy in taking expertise from other organizations and in a way doing a copy and paste because why reinvent the wheel? And so, like I said, I haven't dug deep down into the framework to know maybe where there are slight changes that are needed to localize it for the UAE. But I would envision that the answer is probably yes, because why figure out things from scratch here when you have such a large organization with so many stakeholders having been involved, no doubt, with such a framework. And that's something also that framework will be well understood across the world. And I think that's one of the things when you come to the UAE, there are quite a lot of unique local points when it comes to legal or just even when it comes to the cultural environment, which might be unfamiliar to others. So as much as you can, while still respecting the local differences that are in place, as much as you can maintain legislation and regulations that speak the same language, if you will, as the international space, I think is better for the investor environment. And also, yeah, should make it quite a lot easier for the regulators who can rely on the expertise of others. And then, like I said, just localize it to make sure that it still works within our healthcare system and our healthcare environment, which will have unique points that, for example, don't necessarily quite apply the same as they would in the US.
Absolutely. Thank you so much for that elaboration as well, Christina. So I know we have 5 minutes to go, but I just want to maybe conclude with your final thoughts, Christina, because again, we have the medical education strategy that came out of Dubai Health Authority, medical education and research strategy. We have now a couple of important milestones that has come out, the amendments in the healthcare data, say ICT data law, as well as now the strategy that is coming out of Dubai Health Authority, or the centennial strategy in healthcare 2071, and then the 5-year, 15-year strategies that are actually going to look at disrupting and some of the challenges and new trends that have come because of the pandemic. What are your final thoughts from a legal as well as a regulatory point of view, looking at how digital is being disrupted and how the legislation framework, legislation ecosystem in relation to the healthcare economy is being disrupted? Final thoughts.
I guess on one hand, I'd say kind of jokingly, well, you can't get rid of the lawyers and the regulatory experts. You're going to need us for quite some time. But I mean, this is the truth of the future. More and more so, especially as countries like the UAE seek to enhance their healthcare services, they're going to look to have a bit more control over how those services are delivered and the outcomes that come from that. And so I guess my final thoughts would be, I think key to implementing any of these systems is the involvement of the healthcare professional. It really is. And so we want to create standardization. We want to create efficiency. We want to create better outcomes. But if we just throw together something and push it out, sometimes the result is it doesn't do that. And so we don't want to put in systems just to put in systems and processes just to have processes. Because if it doesn't actually improve outcomes, if it doesn't actually create efficiencies, it's lovely to say you have a digitized process, but what does that really mean? What does that really do? And so I think for any of these is to make sure that the key stakeholders are involved, that the key elements for rolling out implementing like a successful deployment of, for example, here, a digital digitization of the surgical pathway. Make sure those are all clearly understood, well studied. You're working with individuals who clearly understand this, because you know, going back to Dale's question, you will lose the healthcare professionals, you will lose your customers in the way, the end folks, if you are rolling out systems that don't actually help them, that don't actually work. They will find ways around it. It's just human nature. If your system is making my job harder, I will find a way around your system, because I need to make sure my job is easier, make sure my job I can go on and do and meet the requirements that I need to meet. And so I think the key takeaway for me is making sure that when you do roll out systems, they're rolled out in quite a well thought out way, to ensure that it truly does achieve its end goal, which should be efficiency and better patient care and outcomes.
Absolutely, absolutely. Thank you so much for your final thoughts. We are in the last minute. I'd like the audience, I want to thank the audience for their participation and engagement, as well as I would like to encourage the audience to connect with our great guest, Christina, for further elaboration and further dialogue. I also want to thank the organizers for bringing us the first webinar in our series. And I'd like to remind everybody that our next webinar will be in a couple of weeks, and specifically on the 29th of June. I wish you all well and safe. Enjoy Arab Health next week if you're in the UAE. Be safe, and see you on the 29th of June at 7 p.m. UAE time, 4 p.m. UK time, to discuss the importance of informed consent. With this, have a good evening, enjoy, and be safe. Thank you.
Thank you, Dr. Mazin. Always a pleasure.
Always. Thank you much.